Hello, my name is Megan Raby. I am a graduate student at Regis College in the Psychiatric Nurse Practitioner program. I'm here to request funding for a research study, an evidence-based practice project called Can Mindfulness Training Benefit Nurses Who Are Feeling Burnout and Compassion Fatigue from the COVID-19 Pandemic? I'll discuss the plans for this study, and we'll start with COVID-19. In the spring of 2020, nurses were called upon as frontline heroes to care for patients that were suffering from the virus COVID-19. While most of the world was isolating to avoid contracting the unknown virus, nurses left the safety of their homes to provide care and compassion to patients suffering from this disease. There were so many unknowns at this time. It was a scary time to be going into a hospital while you were worried for your family at home, while you were worried for patients that were receiving treatments day to day that were constantly changing. There were shortages of equipment. There were shortages of personal protective equipment. So nurses felt stress of wondering if their own health was going to be compromised. And again, contracting the virus and bringing home these germs to their family who was safe at home. There were also such a rapid increase of these patients that there were shortages of equipment such as ventilators. Patients were dying at a rapid pace. The number of deaths was just increasing daily. And the nurses were there comforting the patients, even though they were scared themselves. The patients weren't allowed to have family members at the bedside, and many of them died, and many of them died alone, except to have the nurses by their side holding their hands and providing the care and compassion that they always do during this difficult time of, like I said, so many unknowns. So that brings us to discuss burnout. Burnout is defined as feelings of emotional exhaustion, depersonalization, and a decreased sense of personal accomplishment. It can happen at any time, at any point in a career, especially in a career such as nursing, where you're constantly providing that care and compassion to others and putting others before yourself very often. But after going through so much during the pandemic and going to work, having all of these feelings of stress and questions of, will I be protected? Will I be able to protect my patients? Is my patient going to die after I care for them for 12 hours? That's a lot. That's a lot to think about day to day. And this went on for 2 full years. It's still going on for many ICU nurses. COVID-19 is not over yet. So there are still people dying. We have been able to maintain a little bit more safety with our vaccination rates increasing, but nurses who have started caring for these patients since March of 2020, it's now April of 2022, so 2 full years of this type of emotional exhaustion can be a lot. The other component that we'll talk about is compassion fatigue. Compassion fatigue is defined as the emotional and physical burden derived from exposure to traumatic and demanding situations. That is the response of the body and mind of the individual to these experiences. And just like burnout, nurses are leaving the bedside because of the trauma that they've seen, the demanding situations that they've been put in. During the pandemic, nurses were getting sick, and some nurses were leaving because of the stress. So there were large and still are large nursing shortages throughout hospitals. Nurses are caring for in the ICU, where they were used to caring for 1 to 2 ventilated patients. They're now caring for 3, or they were in the height of the pandemic. They were caring for 3 critically ill patients at a time. So again, going to work and not knowing if you're going to be protected yourself, not knowing if you are providing the best care that you can because you're under such stressful situations, that's traumatic and it's a demanding situation, and compassion fatigue is the response that many have to that situation. So the focus of the study is to teach nurses about mindfulness. Jon Kabat-Zinn was one of the, or is the kind of leading discoverer of mindfulness. He has the most quoted definition, which is the non-judgmental consciousness that unfolds moment by moment, which is cultivated by paying attention in a specific way in the present moment and in the least reactive and judgmental way possible, with the greatest openness of heart. So this sounds easy when you're reading it off of a paper, but it is challenging to be able to focus your thoughts and your mind in a non-judgmental way when you're under such stressful situations. Mindfulness has been shown to teach the mind to adjust to stressful situations, as well as decrease stress and anxiety and improve focus and cognition. It's seen a lot more in present day media. It's seen on TV. There are apps now that you can get on your phone to help with meditation and mindfulness, because people have really discovered the benefits that it can have in focusing your thoughts away from negative thoughts and focusing more on a positive situation. So the purpose of this research is to evaluate the effectiveness that mindfulness training can have on nurses who have experienced or are experiencing feelings of burnout and or compassion fatigue. The research method that will be used is a quasi-experimental qualitative study. Nurses will receive they'll receive pre and post-training questionnaires. They will also receive a 30-minute PowerPoint presentation via the HealthStream online learning module, which includes videos on guided meditation. The sampling method that we will be using is focused on a community-based hospital in the Northeast. There are 525 nurses that work at this hospital, and an email will be sent with information about the study, including the inclusion criteria. Informed consent will be obtained, and participants will be able to leave the study at any time that's needed. We're aiming for 50 participants in the study. The inclusion criteria that need to be met are the fact that you're 21 years old, you're a registered nurse with a bachelor's degree or higher level of education, you have worked in a designated COVID-19 unit or in an ICU for any period of time from March 2020 to present day. The only real exclusion criteria that we have are that you aren't actively working as an inpatient bedside nurse. So if you had been working on one of these units during the pandemic but have since left, you won't be included in the study, or if there are any experiencing of thoughts of self-harm or desperation. The significance that this study will have to the field of nursing is really just to promote well-being among healthcare staff. So previous studies have shown that mindfulness has proven to enhance coping abilities, reduce stress levels, and promote well-being among healthcare staff. And that's really what we want to happen. We want to prevent nurses from leaving the bedside. We want to prevent nurses from walking away after 20, 30 years of experience, because at the end of their career, they've been through this amazingly stressful situation. And we need to teach them how to take care of themselves before they take care of others, because nurses do care so much about their patients and just show so much compassion and caring through an 8-hour or 12-hour shift that by the end of that, they have nothing left for themselves. So by providing them this mindfulness training, they'll be able to use this in all aspects of their life, at the bedside, at home. And it really is just a way to help focus their thoughts, channel their energy to a more positive way of thinking. And again, the why: nurses are constantly caring for others. Teaching them how to first care for themselves will benefit their mental health, both at and away from the bedside. If you're in a situation where you're short-staffed, or you have a challenging assignment, or you're floating to a different unit, it's very easy to let your mind focus on that negative thought. But mindfulness can help teach these nurses how to focus on, in a non-judgmental way, focus on something positive, so that they can still focus on their patients and provide the care that they deserve. So thank you very much for listening to my presentation. I hope you consider granting this fund for this type of study, as again, nurses have been the frontline heroes for 2 years now, putting their patients before themselves. And it's time that we help them learn just a little bit more about how they can care for themselves. And by doing that, they'll provide even better patient care than they are now. Thank you so much.